Hello everybody, thank you so much for viewing this video. We wanted to have an opportunity to talk with you with regard to what's rolling out right now across the Commonwealth and really across the country regarding the new vaccine and the process, the distribution, the giving of the vaccine, and primarily leading into a conversation as to how Frederick is applying this new opportunity really on our campus, the action steps that we hope to take. And with me is Jeremy Kaufman, our Vice President of Health and Wellness. And Jeremy, for this conversation, I think we ought to demask. We're socially distanced, and folks, please be socially distanced. Continue to wash your hands, continue to observe all of these careful precautions against COVID because it's very real. But we are going to mask at this time. When you think about the issue of the vaccine, the primary concerns today are the risks that are involved, the perceived risks of not taking the vaccine and the perceived risks of taking the vaccine. And different people are assessing those risks in different ways. It could become a very political issue and yet still a very personal issue. And we are looking at, in our community, the opportunity for individuals to act at the personal level in an informed way. And so really hoping that this conversation today, while we can't chat with you, we can share information with you about the position that Frederick is taking in light of the risks, in light of those uncertainties, and yet in light also of the importance of understanding that we still have things that we can do as an organization to both encourage and to facilitate the discussions that are going forward, because we don't have all the answers as of today. We have decided to take the position as a true facilitator of enabling people to get the injections. We will be working with CVS. The injection will be coming from the Pfizer supply. There will be 2 different inoculations for residents and staff, an opportunity, even a third, as Jeremy will share in a minute. But we've decided in this process to not take on a mandate with our staff and our residents, to not become strong even advocates for the process, but rather to be facilitators of education and also opportunity. And so we're here to tell you a little bit more about that today, because it's going to be rolling out on our campus very shortly. So Jeremy, you and our clinical team have been very active in this conversation for about 2 weeks. I know that there's things that we know, and there's things that we're still trying to find out.
Sure.
So would you share with us at this time how we're leaning into this question?
Sure, great. Yeah, thanks. Very good introduction, John. And I think, again, just as a reminder, we continue to do our homework, to do our research, to ask the questions that come to top of mind for us, but we go into this process with the vaccine recognizing that you and we have questions that we just don't even have the answers to yet, right? So we certainly want to invite your questions and your concerns along the way. We'll get you the answers as we have them. But as we sit here today, we can only share with you what we know, right? And so we want to talk a little bit about that. So as John mentioned, yes, we'll be working with CVS. That was who we negotiated with or worked with. There was 2 opportunities or 2 options, Walgreens and CVS. We were working with CVS. We will, at this point, be getting the Pfizer vaccine. What we're being told is that Pennsylvania, that's the supply that they're getting. By the time they show up on our campus, who knows, it could have changed, but at this point we'll be getting the Pfizer vaccine. Again, we know that 2 people, that a person that makes the choice to get the vaccine will need to get 2 different injections for that. And so they'll be here on our campus at least twice. Tentatively scheduled for January 6th and January 27th. And then if there are individuals that miss the 6th or make the decision by the 27th to get it, they would then come back at an additional time to give that second injection for those that get it for the first time on January 27th. But again, it has to be done twice, unfortunately, to get the full benefit of the vaccine. For residents on our campus, just to make everybody aware, we do know that residents in personal care, so Magnolia and Aspen, and in our skilled nursing facility, CW, are in that first tier. Our residential living residents will not be able to get the vaccine at this time through this partnership with CVS It's unknown when they'll have that opportunity, whether the CVS would come back at a later time for residential living residents or whether they would have to get it somewhere in the community. But again, those are questions that we'll continue to ask and provide guidance for those residential living residents. All staff of Frederick Living are capable of getting the vaccine if they would like to. That's part of the Tier 1A that we are part of. So we'll be offering it to those individuals as well. Probably one of the major things that our team will be working on in the next couple weeks is a consent form. So everybody that gets the vaccine will need to sign a consent form, staff and residents. So our team will be working with those individuals to get those consent forms ready to go and signed so that when the people are on campus giving the injections, they're ready to go. For residents on our campus in those facilities or those buildings that are unable to sign their own form, we will be sending those forms out to family members, the power of attorney for them to sign and get back to us. So that's really where our work is right now, John, is just to try to get those protocols in place and those things that need to be done so that when they come onto our campus, we'll have those things ready. So stay tuned, more information to come as we learn those things. This video obviously is being posted on our website, and we're going to utilize our website for a lot of information upcoming because of the rapidness at which the information will come out and the pace at which we need to communicate with residents and their families and staff. We're going to use our website quite a bit to try to keep people up to date.
So folks, I guess the important things here is to understand that we are assessing what is best in our organization. Others are doing the same in their organizations. It's coming from the board of directors, it's coming from the administration, it's coming from other constituencies and stockholders, stakeholders. Everyone who is assessing this process is getting information from different areas. And what we're doing is culling down those important pieces of that information in order to operationalize it appropriately on our campus. And as Jeremy said, we don't know it all. What we do know is what people are sharing with us, reputable individuals. The research is there. A lot of the facts are coming out in greater detail as this process rolls out. We will assess them and have further conversations with you. We thank you so much for your diligence in this process. And we are having so many conversations on our campus regarding the testing, regarding the follow-up, regarding the precautions. This is a whole new piece coming in at this time. We request your patience, your cooperations, and your prayer in this process. So Jeremy, you said the January 6th date coming up. As far as we know, that's the first time we're going to see people on our campus doing this kind of thing, correct?
Yeah, so just, again, we share that with you because we understand that it's close and we want to get out in front of this and communicate as clearly as we can. We are still waiting for that validation call from the CVS rep to say, hey, you've gotten your date and we'll be there. We anticipate that to be happening, but as all things COVID related right now, things can change very quickly, and so we would certainly come back and communicate if it changed. But that's the date that we've been given at this point. That's what we're working towards. As I said, those consent forms, we're going to be working with family members and residents and staff along the way to get them filled out and ready to go, so that when they show up on campus, we can be ready for that. In addition to prayers and support, we obviously want to answer your questions. We're going to be educating people along the way. As you have those questions, you can reach out to me. You can obviously reach out to the clinical team here on campus as well. We will be sending a letter out very shortly that will go to residents and their families and the staff concerning this process that we're discussing today. So you'll get that information, and there'll be contact information on who you can reach out to if you have questions or concerns.
Jeremy, thank you for the work you're doing. Our staff, we thank you so much for your dedication to our residents, to this process, to helping us to discern the best way forward. Thank you for tuning in today. Goodbye.